Assalamu alaikum. So the topic we are going to discuss at the moment is back pain. Back pain is one of the most common conditions encountered in musculoskeletal system. The number of causes, the number of reasons, and a number of present with back pain. Back pains tend to occur at different levels as well, starting from cervical, upper back or thoracic, and lower back or lumbar and sacral region pain. As discussed, it affects about 50 to 80% of population with a large number of uh, patients having neck and lower um, back pain or lumbar pain as most frequent symptoms. Common risk factors include weightlifting, poor posture, prolonged sitting, obesity, and trauma to the back. Most common being poor posture sitting in young adults with bad posture affecting their musculature. Lifting, heavy weight lifting in and trauma in the labor population and working individuals with obesity affecting all age groups. The etiology or the reasons why these pathologies are present, most common being muscle spasm or muscle sprain. This is the most common reason for lower back pain affecting about 40 to 50% of the patient. Disc herniation, which affects the nerve root and usually more than back pain, it usually affects the nerve roots or the nerve endings, which are affected more. Spinal stenosis, which is the affecting our the uh, compression over the spinal cord. Spondylolisthesis, where one of the vertebra is slip past the other adjacent vertebrae. Tumors, less common etiology, and infection, which usually affects in our part of the world. Muscle sprain is the most common cause of back pain and usually affected with poor posture, heavy activity, and this causes stiffness, difficulty in bending, mostly after getting up from a resting position. Usually it affects the all age groups. There's no specific age group with which muscle spasm is common. Most common treatment includes rest, activity modification, muscle relaxants, and controlling the posture. Disc herniation, lumbar disc herniation is most common usually in the lower part, L4, L5, and L5S1 region. Radiculopathy is common. Radiculopathy is basically when the nerve is impinged, it causes pain in the distribution of the myotome and distributed area, the dermatome of that nerve value. This requires a complete neurological examination to determine the area being affected. This is how it looks like the normal disc, which is right at the center nucleus pulposus. It usually bulges out and affects the nerve root, which is impinged and causes pain in its distribution. Usually the dermatomes, the nerve, the area of skin which it's supplying gets affected, and the myotomes, the muscle group which is being supplied by the nerve group is affected, and it's usually the symptoms which occur in this region. Usually non-operative treatment include rest, activity modification with painkillers including NSAIDs and physical therapy. What usually affects is, if we go back to the slides, what usually happens is when the nerve is impinged by the disc, inflammation is caused around the nerve. What actually happens is with rehabilitation, some of the edema is reduced. With NSAIDs, the edema is reduced, and which causes impingement to decrease and symptoms to disappear. However, if it's that is not settled, minimal invasive therapy can be given, which includes a corticosteroid injection. Again, the sole purpose of doing this is to reduce the inflammation around the area. And the operate, and if that does not settle, then it needs a laminectomy. The lamina needs to be removed in order to create space or um, provide more room for the nucleus pulposus to stay, and hence the impingement is decreased, or the disc itself is completely removed, discectomy. The recently, a small, minimally invasive procedure is done to remove the disc, which is called microdiscectomy. Endoscopically, the recent advancement. This is particularly an important aspect as when to go for an imaging. The radiograph, the X-rays, the CT scan, bone scan, and MRI. These are the particularly important investigation. When are they going to appear, and it is going to when it's going to be required? That is the most important question. These are plain radiographs. These show the lateral view of the lower dorsal or lower thoracic spine and the lumbosacral spine. This is usually affected by muscle spasm, trauma, tumor, and the most important thing is to note is that the level needs to be identified. This large bone being with a fused bone is the sacrum. Just above that, it's usually easier to calculate from lower down sacrum than L5, number 5 vertebra, fourth vertebra, lumbar vertebra, third, second, and the first vertebra. The space between the two is the intervertebral disc. From this is the body, behind which it is the pedicle, and then there are the superior and inferior vertebral notch, and posteriorly there is the spinous processes. So the anatomy is particularly important to be recognized. Here we can see the pathology, spondylolisthesis occurring with one vertebra sliding past the other, which leads to impingement at different levels. Similarly important is the anatomy of the cervical vertebrae. MRI is usually indicated in soft tissue injuries, infections, tumors, nerve compression. Sorry. However, it is particularly important to note that any metallic device or electronic devices such as a pacemaker are contraindication to MRI imaging, and then certain different types of MRI need to be done. Another important thing is that if it's a soft tissue injury or a nerve compression, we just need a plain MRI to see the anatomy. While if there is infection or tumor being suspected, in that case, we need a contrast MRI. These are the MRI images, usually a frontal view of the coronary plane. This is the sagittal view, and when we see a horizontal plane, it is the transverse view. These are the sections and planes which we should be aware of. The MRI sequences are important, T1 and T2 weighted image, one showing us the anatomy and the other showing us the pathology. T1 is usually important for seeing the anatomy. Similarly, we need to उसको पेपर में लेके जाओ और नीचे बोलो लेसन देके अगर सही है तो स्टिचेज आउट करवा दो मैं आता हूँ पढ़ाने उसमें भी कॉलेज में ओके ओके लेकिन